What will the rebalanced formal health system look like? We will present here the framework that we envision. We want you to look carefully at what we are imagining. We need your input to develop this framework in more detail. Before we describe how the rebalanced formal health system will operate in the province, we need to explain what we mean by a catchment area. A catchment area is a geographic area that comprises a certain population that can be grouped for the purposes of healthcare delivery. In a larger city, it may also mean a grouping of a specific population within the city. The system we envision is described as follows. In Newfoundland and Labrador, we suggest a catchment area of at least 6,000 to 7,000 people. It looks like there will be approximately 34 catchment areas in order to cover every part of the province. In every catchment area, there is one community team. A community team includes doctors, nurse practitioners, nurses, social workers, other allied health professionals, elder care providers, and others, all providing service to the people in the catchment areas and all connected by virtual technology. Virtual technology also connects the person to the community team. In Labrador, the coastal clinics will be the basis for the community teams on the coast. Health centers. The already existing 23 health centers in the new framework offer a mix of services, including primary care provided by the community team members and a model of urgent care. There may be acute care beds. There may be long-term care beds. There may be a holding bed to prepare a patient before transfer to a hospital. There may not be any beds. This mix would be dependent on geography, distance from a hospital, population size, and available providers. Emergency services. Emergency services are provided in the emergency departments of the 13 provincial hospitals which already have a CT scanner. Every person and every provider in this province have access to a 24-hour provincial health line and virtual emergency services. Emergency services are linked to a provincial land and air ambulance system with advanced care paramedics, which can readily transfer the patient to an emergency department. Hospitals. We need to reimagine the services that are offered within hospitals based on sustainability and maintenance of quality. We envision that each hospital would operate at one of 3 levels of care. We envision keeping the 13 hospitals that are currently in the province. A community hospital offers Level 1 care. Level 1 care includes emergency care, imaging and CT scanning, mental health, acute medicine, elder care, pharmacy, blood testing, and other services depending on the needs of the community. Account will be taken of anomalies in each region to determine additional services. These anomalies may relate to geography, distance from a hospital, or population size. We envision 7 community hospitals in the province. A regional hospital offers Level 2 care. Level 2 care includes more specialized services, including surgery, anesthesia, ICU, obstetrics, pediatrics, specialized testing, a stroke unit, specialty medicine, rehabilitation, and other services, depending on the needs of the region. We envision 3 regional hospitals in the province. The tertiary hub offers Level 3 care. Level 3 care includes very specialized services feasible in one provincial center, such as components of cardiac care, endovascular therapy, neurosurgery, pediatrics, interventional radiology, mental health and rehabilitation services. We envision 1 tertiary hospital hub in the province, located in St. John's. In this framework, every community team in the province is linked to a community hospital, which in turn is linked to a regional hospital, which in turn is linked to the tertiary hub. This rebalanced health system provides you with safer care and better quality and is sustainable into the future.